Hi. I can already see the skepticism in the eyes of someone viewing this video, looking at me. Perhaps you don't know anyone in chronic pain and think that anyone who regularly takes opioids is a worthless addict. Or perhaps you know someone near and dear to you who lost their battle to addiction. This is a tough topic, so let's just dive in. I want to tell you a little bit about my mom and her experience getting pain treatment. Maybe it will help you out. My mom once described dealing with her pain as waking up every morning and deciding whether to reach for a pill or a gun. There were times when she bumped into these so-called doctors and their assistants who should not be practicing medicine. The judgmental attitudes, false accusations, some even pushing pills on her just to get her out of their hair. Recommending unnecessary surgeries to fatten their pocket. She was undeservedly treated like a pariah for years, dealing with nurses, doctors, and pharmacists who jumped to that conclusion and assumed she was a drug addict without truly knowing her medical history. She despised the pill mills that the media always talks about. She's so embarrassed when she has to go get a refill from a new pharmacist. Of course, there are patients that do abuse drugs. There are some script doctors violating their Hippocratic oath. The key word here is some. The majority of chronic pain patients are using their medication responsibly, and their doctors are conservative in what they prescribe. My mom has mentioned that she wishes that some of the judgmental doctors treating her were able to feel her pain, even if it was just for one day, so they could learn some true compassion and empathy. My mom's background is simple. She's a retired school teacher. She loves volunteering. She goes to church. She doesn't smoke, doesn't drink. She eats really well. But despite that, my mom has had really bad stomach pain for years. After seeing lots of doctors, she found that this pain was caused by this condition called chronic pancreatitis. I know it sounds like a mouthful. Basically, what the doctors said is that her pancreas is really inflamed and that the inflammation causes severe pain. She also has some low back pain from a car accident years ago. Her back pain comes and goes, and most of the time it doesn't really bother her. She has seen tons of doctors and specialists for her chronic pancreatitis and has had study after study done at multiple hospitals. It's been so hard for us to see her go through this. Usually her pain is manageable with the opioids that her doctor prescribed her. But last year she had a really bad flare-up and nothing was working. She could barely move, so she went to the ER. Now, for those of you who don't know much about this condition, and I certainly didn't before my mom was diagnosed, it's frequently caused by heavy drinking and IV drug abuse. But not in my mom's case, and even a quick look at her record would have shown that her condition was caused by a rare birth defect. However, when she got to the hospital, the ER doctor never bothered to review her medical records. He gave one look at her and loudly announced, "No narcotics, fluids only." And then he said to her, taking those pain pills are bad for you. She was so humiliated, as if she needed that given how much pain she was already in. My mom is the opposite of a drug seeker. Even when her pain is so unbearable that she can barely walk, move, or eat, she uses only the smallest amount of the pain medicine because she's always worried about getting addicted. I understand that there are people who think everyone on opioid therapy is an addict. And that's medically untrue. There really isn't an easy way to talk about pain management, and we cannot be naive and deny that real drug seekers do actually exist in the world. But my mom is not one. She is in chronic pain. We all know that the opioid epidemic is real. And that's why pain and management clinics where my mom was a patient had her review and sign a pain medication contract. They looked online to make sure there was no doctor shopping, and they also had my mom submit a random urine test to make sure there were no illegal drugs, and she was actually taking her prescribed pain medication. With the proper medication, though, my mom has been a functioning, responsible citizen and productive member of society. It is unfortunate that society makes my mom feel like an addict because she's on chronic opioid therapy. Lots of these healthy do-gooders and media sensationalists wage an all-out campaign to demonize chronic pain sufferers because they don't understand that compassion and empathy actually work better to get true addicts out of addiction. Well, my mom's pain has been constant and severe for years, and she needs doctors that can help her manage that responsibly and, more importantly, respectfully. But unfortunately, finding a place like that isn't easy. We did finally luck out and found one. Yes, I know this sounds like a promo, but it isn't. If you're a pain patient, you can relate. I am prefacing this only because my mom would never disclose to anyone outside of her family that she is prescribed pain medication. It seems that people just tend to jump to the conclusion thinking she's an addict, that she'll overdose at any moment. The part they don't understand is that there's a big difference between addiction, physical dependence, and tolerance. So what changed? Either we change the situation or change how we deal with it, right? So we changed the situation. I can still recall the day when I was in the room with my mom seeing the new pain care specialist for the first time. He said that addiction is a complex phenomenon that some doctors just simply explain as chronic use despite harm. The doctor then said something that really resonated with us. The opposite of addiction isn't sobriety, it's connection. Say what? We had to look it up, and it's really deep and profound. My mom deserves non-judgmental, board-certified physicians and surgeons that will get to the root of the problem, a blend of compassion, understanding, and expertise that is grounded in the latest research. The medical practice that gave us our mom back was Spine and Pain Institute of Orange County, located in Irvine. They took the time to understand her entire case, not just medically, but who she is as a person. They never pushed pills, but they also never made my mom feel badly for needing them. They only recommended spine surgery when it was necessary as last resort. The clinic is real compassionate medicine at its finest. I sincerely hope that no one has to go through what my mom did with the humiliation just because she was suffering. I wish we had found them earlier. I hope you do too. Thank you. Take care.